is highest transmissibility in the first trimester. As the pregnancy moves on, the infection rate reduces. So most is in the first trimester. What is the triad of congenital rubella syndrome? Deafness, cataract, cardiac defects. Which cardiac defect is most common? PDA. Very important, PDA. After PDA comes pulmonary stenosis. PDA is very important. What is expanded rubella syndrome? When this rubella syndrome is associated with diabetes mellitus and renal manifestation, you call it as expanded rubella syndrome. So the diagnosis is based on rubella IgM. Coming to the question. Classical triad of deafness, cataract, cardiac defects is seen in option 1, no, congenital toxoplasmosis as hydrocephalus, chorioretinitis. So that is not the answer. Congenital rubella, yes, that is the right answer. Option 2. Option 3, CMV, where periventricular calcifications are seen. Herpes, congenital herpes also presents with skin lesions. Okay, it will present with skin lesions. So that is also not the answer. The right answer is option 2, congenital rubella. Okay, going on to VSV 23. VSV 23, what is the image given? There is an Aedes mosquito which is causing infection in the mother. This is causing in utero transmission. So what is this? Zika virus, congenital Zika virus transmitted by Aedes aegypti is the vector. So vertical transmission from the baby, from the mother to the baby is possible. So what are the teratogenic effects? Very important, severe microcephaly. Here the baby will present with severe microcephaly, contractures, congenital contractures and eye abnormality. So if you see a baby with severe microcephaly, vector-borne disorder, you are dealing with a case of congenital Zika. Coming to the question. A newborn presents with severe microcephaly. The mother gives history of fever with rash in the first trimester. Which among the following is the probable transmitting agent? So severe microcephaly means Zika. So they also say that there is a rash in the first trimester in the mother. So it is Zika. What is the causative or vector that is transmitting this infection? It is option 2. Aedes aegypti is the right answer. So the answer is option 2, Aedes aegypti. So move on to VSV 24. Move on to VSV 24. So VSV 24 is another congenital infection, that is congenital syphilis. So what are the images you see here? Some skin manifestations called as pemphigus syphiliticus. Okay, and you see nasal discharge that is called as snuffles. So what is the earliest finding in case of congenital syphilis? Snuffles. What is snuffles? The nasal discharge is called as snuffles, which is infective. Nasal discharge is called as snuffles. So in syphilis, you divide them into early congenital syphilis and late congenital syphilis. Early means the onset will be within first 2 years. Late means the onset will be after 2 years. So early syphilis, snuffles, pemphigus syphiliticus, condylomas, and pseudoparalysis of parrot are early syphilis. Late syphilis, frontal bossing, ragates. Ragates is nothing but the skin features that you see around the mouth is called as ragates. Flat nasal bridge, saber tibia. Saber tibia is the bowing of the tibia. Clutton joints, mulberry molars. All these are features of late congenital syphilis. Investigation you do is VDRL. Treatment is crystalline penicillin. Crystalline penicillin. Okay, come to this image. What is seen in this image? You see deafness. So 8th nerve deafness. 8th nerve deafness. Interstitial keratitis. And Hutchinson teeth. This is Hutchinson teeth. What is Hutchinson teeth? The notched incisors are called as Hutchinson teeth. The triad of 8th nerve deafness, interstitial keratitis, Hutchinson teeth is called as Hutchinson triad. This is called as Hutchinson triad, which is seen in late congenital syphilis. Seen in late congenital syphilis. Okay, so this is about congenital syphilis, Hutchinson triad, late syphilis. So coming to the question, a child presents with feature of late congenital syphilis. Which among the following is not a feature, which is not a feature of late syphilis? Saber tibia, yes, it is a feature of late syphilis. Hutchinson triad, yes, it is a feature of late syphilis. Snuffles, snuffles is a feature of early syphilis, early congenital syphilis. Ragates is also a feature of late congenital syphilis. So the answer for this question is option 3, snuffles, which is a feature of early congenital syphilis. Moving on to the next VSV, VSV 25. So please go on to VSV 25. What is seen in VSV 25? You see a lesion in the oral mucosa opposite to the lower second molar, that is called as Koplik spot. You see a maculopapular rash on the body. So the diagnosis we are going to see is measles. The diagnosis is measles. So measles is caused by paramyxovirus. You will have a characteristic feature of fever with 3 C's. What are the 3 C's? Cough, coryza, conjunctivitis. Cough, coryza, conjunctivitis are the 3 C's. So what is the oral mucosal lesion? You see Koplik spot, where opposite to the lower second molar. It is the pathognomic feature of measles, present on day 2 or day 3. So you will have a rash which typically starts behind the ears and spreads to the tongue. 2 important MCQs. Most common complication of measles is otitis media. Most common cause of measles is pneumonia. Most common cause is pneumonia. So this pneumonia is also called as H pneumonia. It's also called as H pneumonia, which is a giant cell pneumonitis. It is a giant cell pneumonia. Last thing, what is the delayed manifestation of measles called as? Delayed complication of measles is called as SSPE. Delayed complication is SSPE. So this is about measles. Okay. Now, coming to the question. A child presents with fever, cough, coryza, and conjunctival congestion. So fever with 3 C's. The diagnosis is measles. Which among the following is the most common complication? What is the most common complication of measles? Otitis media. Yes. So the answer is option 3. Otitis media is the most common complication of measles. So coming to VSV 26. So what is this VSV 26? This is a EEG feature. Okay. EEG, electroencephalogram. Electroencephalogram shows a burst suppression pattern. There is a burst suppression. Burst suppression, burst suppression. Okay, this is a feature of SSPE. What is SSPE? Subacute sclerosing panencephalitis is called as SSPE, which is a delayed manifestation, chronic complication of measles, which almost has a fatal outcome. When will it manifest? 7 to 10 years after measles. Very late manifestation. 4 stages are there. Initial is behavioral changes and poor school performance. Then comes myoclonus, that is a characteristic finding. Stage 3, they will go for chorioathetosis. Stage 4 is going for coma and death. So what is the diagnosis? You look for measles antibody and EEG. This will come under the diagnostic feature. When you take an EEG, you will see a characteristic burst suppression pattern. Burst suppression pattern. So coming to the question. A 10-year-old child presents with poor scholastic performance and myoclonus. I told you, myoclonus is a feature of subacute sclerosing panencephalitis, SSPE. So poor scholastic performance. He has history of fever with rash at 2 years. 2 years of age, the child had rash. At 10 years, they are manifesting with SSPE. Which among the following is the next step? What will you do? Electromyogram. This has nothing to do with the muscle, so electromyography is not indicated. Measles antibody in CSF, yes, that is the investigation you do. Anti-GQ1B, 10 years they are manifesting with GBS kind of syndrome. Which among the following is the next step? What MRI brain, MRI brain is not indicated here. This has nothing to do with the muscle, so electromyography is not antibody in measles CSF. Antibody in CSF. So what is the treatment you can try in these children? Anti-GQ and 10 years they are manifesting with GBS kind of syndromes and not following is the necessary MRI brain, electromyogram. This is the treatment dependent and almost electromyogram is not then you can just prolong the course by giving what are the treatment you can try in these children. Anti-GQ and 10 years they are VSV 26 is over. Which of these following is the necessary MRI brain, electromyogram. This is the treatment dependent and always what is VSV 27 but then you can just prolong the course. Here you have slap cheek appearance as a feature of erythema infectiosum, which is also known as fifth disease. Causative organism, parvovirus B19 is the causative organism. They will present with fever, URI-like symptoms with slap cheek appearance. So, important question. Parvovirus causes what all features? So, parvovirus, other than erythema infectiosum, it can cause non-immune hydrops fetalis in the fetus. So, why do you get non-immune hydrops fetalis? Due to severe anemia. Due to severe anemia. It is not teratogenicity. It is because of severe anemia. Next, aplastic crisis, pure red cell aplasia, myocarditis. These are the other features of parvovirus infection other than erythema infectiosum. Recent INSET had this question. So, a child presents with slap cheek appearance. Which of the following is associated with the same causative organs? So, what is the organ for this same causative organism? Parvovirus. Parvovirus B19 is the causative organism. So, what are the other features of parvovirus B19? Molluscum contagiosum? No. Molluscum contagiosum is caused by pox virus. Roseola infantum? Roseola infantum is caused by human herpes virus 6, also called as exanthum subitum. Also called as exanthum subitum, caused by HHV6. Pure red cell aplasia, yes, caused by parvovirus. Kaposi sarcoma, caused by HHV8 in case of HIV infection. So the right answer here is option 3, pure red cell aplasia. Moving on to the next VSV. So what do you see in this image? You see so many rashes around the mouth, around the palms and this. And it is also seen over the foot. So this is a case of hand-foot-mouth disease. Hand-foot-mouth disease, what is the most common cause? Two important viruses, Coxsackie virus A16, enterovirus 71 are the most common causative organisms. So how will they present? With a prodrome of fever, ulcers and blisters in the oral cavity, palms and soles. What is the complication? Very rare, myocarditis and meningitis.
The only way to do it is to automate it. What Zapier allows us to do is connect to our customers' Shopify store or WooCommerce.
Coming to the question. So how will they present? A 2-year-old child presents with ulcers and blisters in the oral cavity, over the palms, soles and oral mucosa. What is the complication? Which among the following is the most common cause? So around palm, soles and oral mucosa.
The only way to do it is to automate it. What Zapier allows us to do is connect to our customers' Shopify store or WooCommerce.
So the correct answer is question. So how will they present? A 2-year-old virus fever is going to cause either lesions over the palm, soles and oral mucosa. Parvovirus, which among the causes is the most common cause? So around palm, soles and oral fever rash plus HFM. So the answer is option 3, enterovirus. That is the right answer for correct answer is question. So how will they present? A 2-year-old virus fever is going to cause either lesions going on the palms and oral mucosa. We have vaccine. What is the vaccine? Measles, where you have diphtheria, pertussis, tetanus. What is the dose? Enterovirus 5 ml intramuscular. Correct dose that is. So how will they prescribe? A 2-year-old virus 6 weeks, 10 weeks, 14 weeks, either you have going course of around 16 to 24 months and finite. We have 24 months. What is the vaccine? Measles, where you have diphtheria, pertussis. So what is the type of TB vaccine? Type of the vaccine intramuscular. The diphtheria component prescribed a 2-year-old virus 6 weeks, 10 weeks, tetanus component you have going course of around 16 to 24 months and pertussis component is 24 months. What is the vaccine? Measles, what is the type of TB vaccine? Contraindicated. Type of the vaccine intramuscular. Diphtheria component anaphylaxis previous dose. encephalopathy within 7 days of the previous dose. Progressive neurological deficit. Okay. Progressive deficit. CP will not come here. CP is a static deficit. In these cases, you do not give. Out of which progressive neurological deficit is a relative contraindication. You can give DT or TD there. Now, the next is precautions. What is precautions? Fever more than 40.5 degree within the past 24 hours, 48 hours. Hypotonic, hyporesponsive episodes within the past 48 hours. Inconsolable cry for more than 3 hours within the past 48 hours. Seizures within the past 72 hours of previous vaccine. If these 4 are there, it is a precaution, not a contraindication. But if precautions happens more than 2 times, it becomes a contraindication. For example, 6 weeks, you see the baby had hypotonic hyporesponsive episode. For 10 weeks, it is not a contraindication. But for 6 weeks also the baby had this. 10 weeks also the baby had this. For 14th week, it becomes a contraindication. So for more than 2 times, precautions becomes a contraindication. So this is about DPT vaccine. Important point. Another important point, in case of lapsed vaccination. Lapsed means they have not given the vaccination. For less than 7 years, you can give DPT. But for more than 7 years, do not give DPT. You will not give DPT. Instead, you will give Tdap or TD. Less than 7 years, DPT. More than 7 years, do not give DPT. Give Tdap or TD instead. This is about DPT vaccination. Okay. A 14 weeks old infant has come for routine immunization. Which among the following is not a contraindication for DPT? Not a contraindication. Anaphylaxis is a contraindication. Encephalopathy within 7 days. So day 3 is a contraindication. Hypotonic hyporesponsive episode is a precaution and not a contraindication. Progressive neurological deficit is a contraindication. So which is not a contraindication? Option 3. If HHE appears more than 2 times, it becomes a contraindication. Ideally, more than or equal to 2 times. So the right answer is option 3. Moving on to VSV 30. VSV 30, what is the vaccine? Cervavac. What is Cervavac? India's first indigenously developed vaccine against human papilloma virus. It is a quadrivalent vaccine. What are the strains there? 6, 11, 16, 18. Out of which 16 and 18 are the oncogenic strains. They are the oncogenic strains. Okay. So 2 schedules are there for less than 15 years, more than 15 years. More than 9 years, you will give for adolescent girls. So to whom is given? For girls only, not for boys. In India, it is given only to girls. Less than 15 years, 2 doses. More than 15 years, 3 doses. Other HPV vaccines, we have Cervarix and Gardasil. Cervarix is a bivalent one. Gardasil is quadrivalent, and sometimes you even have 9-valent vaccine in Gardasil. This is about HPV. Recent question from HPV. What is the antigen that is seen in HPV vaccine? It is L1 antigen. Okay, L1 antigen is seen in HPV vaccine. Okay, so now coming to the question. Cervavac protects against which among the following strains of HPV? Option 1, 611. Option 2, 611, 16, 18. Option 3, 16, 18. Option 4, 16, 18, 31, 35. Cervavac is a quadrivalent vaccine which protects against 6, 11, 16, 18. So the right answer here is option 2, 6, 11, 16, 18. It is a quadrivalent vaccine. L1 antigen is present in the vaccine. So this is VSV 30. Moving on to VSV 31. Another important question. What is VSV 31? Vaccine vial monitor. So what is a vaccine vial monitor? Inside the square, you have a heat-sensitive material which will change color on exposure to heat. See, this is stage 1. This is stage 2, stage 3, stage 4. Stage 1, the square is lighter. Stage 2, it is changing color but still lighter. Stage 3, same color. Stage 4, square is darker. When the square is lighter in color, you can use. When it is same color or darker, you should not use. So stage 1 you use, stage 2 you use, stage 3 don't use, stage 4 don't use. Okay. So coming to the question, which among the following vaccines should not be used? Yes, 3 and 4 should not be used. So what is the answer? Option 4, 3 and 4 should not be used. When it is same or darker in color, you should not use. Now, one more topic we are going to see here, that is called as open vial policy. What is open vial policy? Once the vaccine is open, you can keep the vaccine for 28 days. Keep the opened vaccine for 28 days. Okay. Only after 28 days, you will discard if VVM is normal, if your expiry is not reached. Okay, all the vaccines under National Immunization Schedule comes under this open vial policy except BCG, MR, Rota. BCG, MR, Rota, no open vial policy because BCG is a reconstituted vaccine. You reconstitute it with normal saline. MR reconstituted with distilled water. Rota available in liquid form. In all these 3 vaccines, once you open, you use within 4 hours. Use within 4 hours. Other vaccines you can use for 28 days. One more thing, live JE. This applies to live JE also. Some areas they give live JE vaccine, some areas they give inactivated. If it is a live JE vaccine, then you will use it within 4 hours. If it's an inactivated, you can continue this open vial policy. Okay, so going on to the next VSV, VSV 32. So VSV 32, you see a rash over the body. What erythematous rashes are present over the body, which is a new
You will get 49
so
euro
what is this?
cashback on blood
Erythema toxicum develops 1 to 3 days after birth, which is a benign rash. If it's an inactivated, on its own by 1 continue this open vial you don't have to do anything, you just resolve. So going on to the there inside the rash? They are laden with eosinophils. Eosinophils are there inside the rash. You see what are the other normal conditions in case erythematous rashes, pustular melanosis, which is a new pulse, what Mongolian erythematoria. These are other normal dermatological findings. This is a benign rash, pustular melanosis contains by neutrophils. Okay, you don't have to do anything, you just resolve. Contains neutrophils. What is there other normal findings? They are laden with urine and meconium members are there in past. You see what are the other normal conditions? Urine by 24 hours, pustular melanosis, meconium by 48 hours. What is urine by 24 hours, normal dermatological findings, 48 hours, pustular melanosis contains by 1. You have another condition called as Harlequin's color change. So what is there other normal findings? We are laden with urine and meconium color change. You see what are the other normal conditions? Urine, one of the body will be, other half will be, first what is urine by 24 hours, normal dermatological findings, 48 hours, pustular melanosis contains by 1. You have another condition called as Harlequin's color change. So what is there other normal findings? We are laden with urine and meconium color change. You see what are the other normal conditions? Urine, one of the body will be, other half will be, first what is urine by 24 hours, normal dermatological findings, 48 hours, pustular melanosis contains by 1. You have another condition called as Harlequin's color change. So what is there other normal findings? We are laden with urine and meconium color change. You see what are the other normal conditions? Urine, one of the body will be, other half will be, first what is urine by 24 hours, normal dermatological findings, 48 hours, pustular melanosis contains by 1. You have another condition called as Harlequin's color change. So what is there other normal findings? We are laden with urine and meconium color change. You see what are the other normal conditions? Urine, one of the body will be, other half will be, first what is urine by 24 hours, normal dermatological findings, 48 hours, pustular melanosis contains by 1. You have another condition called as Harlequin's color change. So what is there other normal findings? We are laden with urine and meconium color change. You see what are the other normal conditions? Measure one of the picture of body will be pink, other half will be first what follows is urea. These are our normal dermatology findings. Transient pustular another transient pain condition. You have another condition called as harlequin's color change. So what is there in other normal findings? They are urine and meconium color change. What are the other normal findings? Measure one of the picture of body will be pink, other half will be first what follows is urea. These